Thank you, Quint. And I want to thank you and your team for providing this opportunity for us to thank our healthcare heroes who show up and go above and beyond to care for their patients and each other, especially during this pandemic. I am in awe of you. In crisis lies opportunity, and this pandemic has shed light on the racial, social, and health disparities that have affected communities, especially people of color, for decades. I applaud healthcare systems that are looking at how they can address health disparities in new ways. Health disparities, those differences in health outcomes across racial, ethnic, and socioeconomic groups. I'm also grateful to the many healthcare systems that are reaching beyond their hospital walls, recognizing that healthcare access is not enough. People need access to affordable housing, healthy food, jobs that pay a living wage, education, and healthy environments to thrive. This moment matters. Today, I am grateful to share our story with you. Our story that brought a community together to improve infant mortality and maternal health. When you look at the city behind me, you see one thriving city of Cincinnati. But when you start to look below the surface, you will find two cities, one white and one black. And Black Cincinnati is disproportionately impacted by factors that prohibit them from achieving their highest level of health and well-being. When you look at life expectancy, zip code matters more than genetic code. You can look at two zip codes that are 5 miles apart. One has a life expectancy of 85 years, the other 70. Why? Because social determinants of health are the key ingredients to well-being. And those ingredients vary in abundance and quality from zip code to zip code. To illustrate this point, let's consider two very different pregnancies. One is my own. When I was pregnant, the first thing I did was tell my husband, of course, but then I called my OB-GYN to schedule my first prenatal appointment. I easily drove my car to all of my various appointments, not worrying if I had to leave work because I had an understanding employer. And before I got too uncomfortable, I had good night's sleep. I didn't worry about losing the house over my head or a dispute with my landlord. And I never once was worried that my concerns wouldn't be heard, addressed, or that I wouldn't receive the quality of care I needed to have a healthy birth. But a woman who lives 15 minutes from me, a Black woman, has a very different experience. When she finds out she's pregnant, she fears her first OB-GYN appointment and may put it off because of the discrimination she's faced in the past. She has to take 3 buses to get to her prenatal appointment and worries that if one of those has to be during the day, she may lose her job from leaving work. And at night, she lies awake worrying about the electrical issue that her landlord won't fix and the safety of her other children. And if that's not enough, she's afraid. She's afraid that when it comes to delivering this baby, the doctors won't hear her concerns or that she won't receive the same quality of care she needs to have a healthy birth. This moment matters. BI3, our grant-making initiative to transform health in Greater Cincinnati, has been investing in the improvement of maternal and infant health for nearly a decade. The results speak for themselves. 200 babies are alive today due to these collective efforts to reduce infant mortality. 200. That's like 7 classrooms of kids. And although infant mortality and Black mortality for Black Ohioans is high, our partner, Cradle Cincinnati, recently reported that 2020 had the lowest infant mortality rate on record for both white and Black babies. So how did we do this? How are we making progress? It started with a grant from BI3 in 2012 that fueled an unprecedented collaboration, including competing hospital systems and trusted nonprofits, to look at one neighborhood that had one of the highest infant mortality rates in the country. This was a Black neighborhood. And the team began by listening to Mom, really understanding her distrust of the healthcare system and understanding the racial, social, and economic barriers that get in her way of engaging in prenatal care. We used our IDEA framework along the way. BI3 encourages people to I, identify strengths and leverage your strengths. D, drive cross-sector collaboration. E, encourage learning. Nelson Mandela said, you never fail. You win or you learn. And attracting diverse leaders. Diversity of thought is so important when you're addressing deep-seated community health issues. I am so proud of this team, the way they came together and talked with moms and co-designed a new model of care that puts mom and baby at the center and surrounds them with the supports they need to have a healthy pregnancy. In 4 short years, this very neighborhood went from having an extreme preterm birth, the leading cause of infant death, having one every 26 days, to 0. And they kept it at 0 for 3 straight years. We felt like we were onto something. And even though every neighborhood is different, and you have to begin by listening to the people in those neighborhoods, we were able to attract additional funding from Ohio Medicaid and HRSA to be able to expand this to 12 other neighborhoods that are seeing similar results. And we've been able to scale and spread this even beyond Cincinnati through a grant that Cradle Cincinnati was awarded to spread the model to 8 other cities across the country. I'm really excited to invite 2 special friends and partners in this work, Jeremiah Kirkland and Meredith Shockley Smith. I want you to hear personally from them what this journey has been like, how they've been able to really engage with moms and co-design, as well as push on the hospital system to create a more diverse, inclusive, and equitable culture. Let's go talk with them.
BI3's grant making has evolved through the years. We recognize that change and better health outcomes are achieved when we center the voices of those with lived experience. I am so excited to talk with Dr. Meredith Shockley Smith, a friend, a partner, who is Director of Community Strategies at Cradle Cincinnati, that is really driving and fueling the reduction of infant mortality. Thanks to funding through BI3 and thanks to her and her team, they are working with women to build solutions to some of our deep-rooted health issues. Before we get started, I just want all viewers to know that we are practicing safe protocols given the pandemic. We are fully vaccinated and sitting 6 feet apart. So we are going to talk about some innovative ways that we are working together with moms to solve some of our deep-seated community health issues. And unfortunately, Black women inherently distrust the healthcare system with good reason. There is a history of mistreatment, unwanted medical procedures. I mean, the history is really deep here. So the distrust is understandable. So can you speak to some of the more innovative ways we're trying to rebuild trust with our Black community, especially our Black moms and healthcare providers?
Sure. I think that building trust really started with ourselves. So we had been living in this individualistic society that the U.S. has created, but had come historically from a collective society where we supported each other. And so we just didn't trust anybody, including our neighbors. So the first goal was to find a group of women, a community advisory board, who would say yes to asking questions and to moving forward with what women wanted and to help build trust. And so I'm like standing at the door and looking for people that I might not know, but who might be wandering around looking like they want to save Black babies. And I'm like, are you here for, and finally the last one rolled in, and they stood in front when we signed that document, and they have been committed to the work ever since. And for those 10 women, I am truly grateful, because we just couldn't have, A, reached as many people as we wanted to, or B, really started that process so quickly with people who were really, we really needed them to be ready to rock and to show up. And to be willing to go out into the community and to ask those scary questions. And then to come back and tell people who didn't look like them the answer. And that was pretty intense, a conversation, but bold. These women were just bold and ready to see change. And the rest of Cincinnati showed up. They're like, yeah, thank you for asking. And then our next move was, how do I get you to trust me? And so we started to build community. And that building community piece was the key. It was the shift in the way in which we do this kind of work. Typically, we create an idea from our own minds, whoever that is, and often not a Black woman, and then we are like, let me get funding for this idea, and then you do it, and whether or not it's working, you're on a 3 years, you just keep doing the same thing and hoping for a different result, which is also
insanity.
Thank you. Mm-hmm. Also the definition of insanity. And so really that piece of the work, and I say this all of the time, but flex dollars from BI3 really allows us to do that and build that trust work was essential to the shift, because then they started to hear the messaging around health and prenatal care and what needed to change or shift in the way in which we behaved in order to have longer, keep our babies in longer, because extreme preterm birth is the hardest.
Leading cause of infant death.
Battle to tackle. You got it.
Mm-hmm. And that trust is so important to get early prenatal care, right?
Yes, I want to go only if I want to spend time with you, if I trust that you're going to be the person who won't judge me. So, we live in a society where if you're not heterosexual, married, and of a certain age, and maybe even of a certain education level, then why are you getting pregnant? And then there's this shame that gets passed around. And so that's another thing that we try and do at Queens Village, which is to say, if you are having a baby, we are celebrating that. And what we want is for you and your baby to be healthy.
So Meredith, you've mentioned several times Queens Village. Can you share with us what is Queens Village? I know it's your brainchild, but can you kind of describe what it is and why it's so important?
And the community said, I don't feel heard, seen, or valued. And my biggest problem with pregnancy and my baby up till 1 is that I am stressed to the max and I feel isolated, as if quarantine did not impact that enough. So that's what we went to work on, creating a strategy that helps them feel like we are hearing them. It helps women feel like the narrative is changing and that we are celebrating them. So we did lots of specific things, from the dinners that we shared to yoga and meditation for stress relief. And then the gathering together. So there are 2 kinds of gatherings. One is kind of across lines of difference, so that we're building empathy with the medical professionals and sort of looking at the wraparound program, so direct service of cradle connections and policy work. Last night, we were on a call and we were talking about Queens Village, and there was a queen who was on there, and she told her story about why she came to the village and what it gave to her. And so, in the beginning I talked data. Like, I can tell you that infant mortality is down 18% in 2020, which was down from 2019, and we had,
lowest on record for Black and white babies, right?
Exactly. So we are really having a great celebration right now. But I think that is the end-all goal, overarching. But when we think about public health, the fact that you are reaching women at a level of healing and emotional stress, that talks about sustainability of that work. It talks about lifting up leaders and creating systematic change in hospital systems. That's the story, I think, that for me gives me the most excitement, the most joy. She was like, I was at my worst. I had lost my job, I had 2 children. I was pregnant with my 3rd. I was having a difficult time with pregnancy, and I came to an event and someone got my number, and called me and followed up and said, how are you doing? And then came over, showed up. And that's the work of a village, where it's like, in quarantine, it was like one of those things where, thank God we had been working for a year to know each other because we needed each other for sure in that time.
So can you say more about that? The pandemic has challenged and changed all of us. And here are a group of women who were able to come together and building that support, and then the world changes and they can't see each other. Can you talk? I know you and your team had to get creative. How do we keep this support system in place when they need it most? Can you speak to some of the creative ideas you've tried? What worked, what didn't?
One of them was that school shut down and they needed to get every household technology. So the computers were a beautiful thing, and they needed to get Wi-Fi in places where Wi-Fi wasn't going very well or where that Wi-Fi was slower. And so we were able to use that technology that was given by somebody else and paid for by somebody else to support moms in ways that they really needed to. So we were able to ask, what time of day works best for you? Is it Facebook? Is it Zoom? So creativity, like partners in the community, we always try and lift Black women. So Black women artists would send in, like paint by numbers, and we would mail it to their house, and we would have activity rather than a talk. The creativity was off the charts. I will own none of that. I will say it was the community of people who were like, I have an idea, I have yoga, I can do dance.
So what advice would you offer other healthcare systems, communities across the country who are committed to doing things in a different way to start to address our racial and health inequities that this country faces?
I'll say the things that I've learned that could be helpful, that I really appreciate, was that asking the people who are going to receive the service what it is they want is the most sustainable way to create an intervention. And so my first advice is always ask. Then the second advice is, if you aren't willing to do what they ask you to do, be careful, about whether or not you're able to do that, because it's then build trust. And so that means you're going to need to respond in kind. And then the next thing I'd say about it is you could do that lots of different ways. So you could say, I have an advisory board for this experience or for that experience. But the more those folks are in relationship, the more they trust each other and the people who are messaging in. So that means that I can now choose somebody who might not be a Black woman, who is not in this space, but you trust me to choose an OB-GYN, for example, to come in and share with you about maternal death or about infant mortality or about exercise or whatever it is. And so continued sustainable relationships with folks you're trying to serve. I would say my other big be careful is find some flexible dollars. You cannot respond to the community if you are required to do an intervention you've already prepared, because what I will tell you is it's a process of becoming. Going in, doing what they asked. Did it work? Did we do it well? Do you want the same thing? Do you want something different, and then redo? So it's constantly changing. Our team does daily check-ins for an hour to assess whatever happened the day before or what's happening 2 weeks from now. It's that ongoing. So let me just say one more time, BI3's dollars is really making the difference between being able to go and do that work and build trust.
So, we have a lot more work to do, but to your point, it is important to celebrate the milestones. And the fact that 2020 had the lowest infant mortality rate on record is something to be celebrated and gives us hope for the future. So can you share just what you feel from a gratitude perspective when you think about that?
I wake up every day in general thinking what a gift that Cradle Cincinnati is to have. At the time I walked in, white leadership team, and they brought me in and they said, work on racism. I said, okay, this is going to be challenging for a bunch of white folks. And they were like, we're on board. And they have been entirely on board the entire time. They have lived the work, the anti-racist work, changing minimum pay for community health workers to expanding the team. It's been awesome. So I'm entirely grateful.
Meredith, we've talked a lot about engaging with women in the community, hospitals moving beyond their own walls and working in partnership with the community. How has Queens and this community been able to connect back in to healthcare systems and really fuel culture change within the healthcare system?
The Queens have been on a journey for the last 3 years inside systems. So, for example, when we did equity training at every hospital system, they were in the room with medical professionals. So when we had conversations, it included everybody's voice as we're thinking about, like, what do you want to change? Hospital systems being ready to share their equity work externally.
That's huge.
It's huge, so that moms will know, like, am I safe here? Do you know there's a problem? Are you acknowledging it? Are you working on it? I think there's also a reality of policy work. So what policies are happening in the hospital that are negatively impacting infant mortality and maternal death? And so they are able to help name that and then go as far as to lobby with you and to think with you as you change and lift the equity work happening in each hospital system.
And I know that you've taken some women to Columbus, to the state capitol, and had them share their personal stories. Did that resonate with the politicians?
We've had some wins around housing and women who are pregnant going to the top of that list so we can get infants safe and healthy housing. So I think policy is super important. Systems change, thinking about what needs to actually shift to have a sustainable outcome. So it's wonderful to have 2 years of winning and the lowest infant mortality rate we've ever seen in Cincinnati. But it's another thing for us to not be having this conversation in 3 or 4 or 10 years. So what's the sustainability piece?
And that's what we think a lot about, and you know this with BI3 is, we fund direct programs, but programs only last so long and help so many people until the funding runs out, right? And so how can we look at programs differently to really feed policy change, right? There's so much happening within a program that can help facilitate change at different levels.
The sustainability piece of the work without money, in particular in community work, is that the community starts to hold it themselves. So what we're doing essentially is dinner and relationship building, which is how everybody's got to eat dinner regardless. So if you bring your one item to the table and you start to build trust and relationship, even across lines of difference or in your own community, you start to have you've changed all on your own. It doesn't cost you money. And it builds all the capacity. So capacity building and community building really is a sustainable model.
Well, Meredith, it has just been an honor to talk with you today. I love your passion and your commitment, and I just feel like we have developed such a trust-based relationship with you and your team at Cradle that I'm excited for the work ahead, and I hope we continue to make the progress we all seek.
I am so grateful. Thank you so much for this time and for our partnership. It's always great to hang out with you.
Thanks, Meredith. BI3 is focused on creating sustainable systems and culture change. We are uniquely positioned to do this thanks to our strategic partnership with TriHealth, a leading integrated healthcare delivery system in Southwest Ohio. This partnership allows us to readily pilot and scale new approaches, such as the mom-centered approach to prenatal care, which we've been able to expand in the OB-GYN Center that serves a large population of moms who have Medicaid as their primary insurance. I am so excited to talk with my friend, my colleague, Jeremiah Kirkland. He is lead over women's services. He has really accelerated diversity, equity, and inclusion efforts here at TriHealth, and he was just named president of one of our hospitals. But above all that, he is a committed leader for change, and his passion drives others to action. Thanks for joining us today, Jeremiah. Welcome.
Thank you, Jill. Thanks for having me.
Nationally, Black maternal mortality is 3 times greater than white mortality. And we find that Black women suffer from higher rates of medical errors, of heart issues, lack of proper care coordination. So can you share with us how you're looking at improving maternal health within women's services, especially for those women who face racial, social, and economic barriers?
Jill, great question, and I'm happy to share with you some of our approaches, clearly some of which we've partnered on, but first we start with the problem. Like you've outlined, this has been a significant issue, not just here in Cincinnati, but throughout our region and throughout the country. And one of the ways that we have said we are going to address it right here in Cincinnati is through approaching the problem head on and focusing on how do we, one, hear from the community, hear from these moms, listen to them, take into account things that we might not have addressed or heard before because we've relied on our own information to address the problem. The first step was going into the community, listening to mothers who have said, the reason why we're having some of these outcomes is because we don't feel heard by our providers. We do feel like racism has played a role or implicit bias has played a role in the care that we received, and we are not listened to by our clinical providers and our care team. We took that information and then said, you know what, let's look in the mirror. How can we as an organization understand that we need to help address some of these needs in caring for these moms prenatally and then in the postpartum phase. And we said as a team, we can only do but so much. You know, we can control certain interactions in care and certain episodes of care, but that's not the full picture of what the patient is living through. That patient leaves our health system, leaves our doors, and they go out and they go into an environment that has impact on their health. They go out and try to look at, what food they can purchase, their housing. All of these things play a role in the overall care for that woman and in the child, in the baby, in their health outcomes. So we have said in partnership with BI3, with our medical legal aid partnership, and with our partnership with other organizations throughout Cincinnati, how can we help address mom's needs across the board? How can we make sure she has appropriate housing, the electricity is turned on, that she's got the right access to food, and all of those social needs, and then also medical needs, behavioral health needs. How can we address those quickly? How can we work with the right partners to get mom the support she needs? And then make sure that she understands that we're partners in her care. So I think it's just been truly a collaboration, bringing the patient to the center, making sure we're listening appropriately, and then taking action through our partnerships.
So I'm going to ask you to expand a little bit upon that. Healthcare systems in the past have been somewhat siloed. And when we want to fix a problem, we think it's just easier to do it ourselves than in partnership with community-based organizations. So can you speak to the importance, and BI3 has fueled a lot of partnerships, like you mentioned, the Legal Aid Society and starting the Maternal Health Law Partnership at a high-volume OB-GYN center that helps reduce those health-harming legal needs for moms. I met Tamaya, who couldn't sleep at night because she had an electrical issue, and through legal aid, they were able to resolve that for her in 3 days, and she could get sleep while she's pregnant. So can you talk about some of the challenges, but also why it is so important for healthcare systems to work in partnership with the community and not get siloed?
It really has to do with how that patient is living outside of our walls. I think historically we have been siloed because it reminds me of the saying, if you want to go fast, go alone, right? And as a health system, if we want to make quick changes, let's just do this by ourselves. Let's spearhead this. Let's move forward. We have people within our hospitals and within our offices. Let's move fast. Let's go. And we essentially go alone when we're operating just as a health system. But if you want to go far, you go together, right? And if we want to go together, that means incorporating lots of people in the community and listening to our patients and then taking action, partnering with BI3, partnering with other institutions. And we have failed to do that because we have operated alone, thinking that our siloed health system has all the answers. Healthcare is mental, is physical, is spiritual, and we have to work to address all those three things as best as we can. And we only do that through partnerships. We best do that through partnerships. We've had instances and situations where a mom has come to us and said, I'm being evicted, and I have 3 children. I am 7 months pregnant, and right now the most important thing to me is making sure I have a home and a shelter for me and my kids. I am a single mother, and I don't have a lot of support. At that moment and at that time, we know that mother is not thinking about coming to her next prenatal appointment. We know she's not thinking about, has she run out of prenatal vitamins and does she need more? She is thinking about food and shelter. And if we can't address those needs, we as a health system by ourselves, we don't have the infrastructure. We cannot write a prescription for housing and for additional food. The structure that we have set up as a health institution and a health system is very limited in our silo. But when we reach out and connect with partnerships in the community, we can immediately provide housing, find funding. We can help put a stop to an eviction. We can really try to drive those changes that help meet mom's social needs to get her to have better outcomes from a health perspective. And when she's ready to deliver that baby, we reduce stress, we improve hypertension, all of those things we're able to help when we look at all of those social needs together. And we only do that when we're in partnership with other organizations here in Cincinnati.
Agreed. And I'm so grateful that you and your team are aware of tracking outcomes, because to achieve sustainable change, we have to push on payers, right? We need to prove that especially Medicaid needs to start reimbursing for addressing these social determinants of health. If we can address a small social issue that leads to a healthy pregnancy that otherwise may have been challenging, let's move upstream. But the only way to do that is to track the outcomes and collect the data and try to make a great case for change.
We know policy change and change to support reimbursement will allow many health systems, not just our health system, to get it right across the country to address these needs, because they're in every community that I've been in.
In a national poll, 1/3 of Black Americans reported that they experienced discrimination from a healthcare provider.
That is a very challenging statistic, and while I want to say that I wish it wasn't the case, I wish that was not the reality. Far too often has been the reality in many of the communities I've worked in, whether it's in New York or here in Ohio, or in Atlanta and other areas throughout the country. I have seen that to be the case. I've seen it reported in many instances, and it doesn't even matter of what someone's socioeconomic status is. You could be on the higher end or the lower end. Individuals have reported that they have felt that in some way, form, or fashion, and it shows in the data across the country. The reality is implicit bias plays a role in all of our lives, and implicit bias toward those of a different race, and specifically people of color, is a reality in every health system in the country. And I think we have to educate, we have to train, we have to develop, and help individuals think differently when approaching that very difficult topic. Challenging question, but the reality is I don't have all the solutions, but I do know there's some work that can be done across every health system in the country to improve it.
So BI3 has partnered with TriHealth, especially Women's Services, to offer implicit bias training, cultural competency training, but there's challenges to that work too. So can you speak to how that's going, some of the results you've seen from these trainings, and then some of the challenges you've had to face and how you've overcome them?
First and foremost, I am very grateful for BI3 partnering with us to help allow us to bring in really a world-class organization to help us with training and education. We cannot do this alone. We said, let's get on this journey. And it doesn't stop with one training. It doesn't stop with a 3-hour session in a classroom. So we said we have to look at these things and then understand that what might be coming into play when you have a bias. So unpacking these biases and addressing these issues help us be very vulnerable. I think sharing things that we wouldn't share normally comes out in these sessions. And then it helps us take some tools away. One really strong tool we learned about was how do we pause, stop, and think about what are we seeing? What are we about to say? How are we experiencing this interaction here? And I think it's just been very powerful.
It's important work. And you know, when you look at the data, right, and you mentioned this earlier, I mean, when you account for education and income, I mean, a Black educated woman has worse healthcare experiences than a white person who dropped out of high school. So there is racism at play there when you hold all factors, when you account for all other factors.
Yeah, that was probably some of the most difficult work in looking at and working and partnering with Cradle Cincinnati, looking at the data, looking at the facts, and saying that this is, you strip all of these things down on all of these factors to still have such economic and health inequalities it was extremely unfortunate to look at this data and see that every way we looked at it and turned, you could not ignore race when looking at overall outcomes. And I think that we had to specifically target how do we improve this systemic racism issue or this bias issue that's coming into play, and making sure these moms are heard, because what's happening here is that we are not, you can't just look at it as like the numbers without a narrative. The narrative is we have mothers and babies who are dying at an alarming rate. And in some cases, just by listening to that mom, Serena Williams, a primary example, just by listening, multi-million dollar tennis player
And her voice
and
isn't
professional, and her voice isn't heard about care that she's received in the past, and ignored about care that she thinks she should receive in order to help address her medical needs. And when we have issues like that come into play, how much more significant is it for a mom who's not Serena Williams, for a mother who isn't a known entity in the sports world or in the entertainment world, but it's just a mom in the community who comes in and says they feel pain or they need more medication, to not receive it. And a number of times we've seen that the worst possible outcome, that mother dies or the baby dies, or both. And I think we need to work, if we don't get everyone around this and to lock arms and to partner in the community to try to eliminate it, we are not going to see the outcomes we want to see.
So let's talk a little bit about healthcare and the need for diversifying our physicians, our clinical staff, because that plays a big role in trust.
Yeah.
So let's talk about one of our favorite topics, which
Okay.
is the School to Work program that you have taken the lead with Mark Clement's blessing on implementing here at TriHealth. And I know that you had experience with it in Rochester, but this School to Work program that provides internships for diverse students and really exposes them to all the different areas of healthcare, right? I mean, a lot of people, when they think healthcare, they think doctor, nurse, but there's all these different areas from radiology to pharmacy. So can you talk about the importance of this program? And I know it's changing lives for students, but can you talk about the importance of this program and your vision as it impacts the healthcare system?
It wasn't until I got into the School to Work program in Rochester that I realized healthcare is so much broader, and a health system or even a hospital system is so much broader. And you have radiology, you've got respiratory therapy and respiratory care, you have your nutrition team, you have pharmacy, you have your sterile processing team. You have so many areas that really help make the system run and operate. You've got your lab, you've got other core services. And I said, wow, this is like a whole different world to me. Like this is way more than I thought would be inside the operations of a health system. And I said, if we could, I got exposure so young, so early, and I learned that my passion was going to be in a hospital, working in healthcare, or working in a health system. And I quickly learned that if we could do this for other students, hundreds of students across a city, thousands of students across the state, hundreds of thousands across the country, we could make huge changes and huge waves in healthcare. So me being a young black man, stepping into a program like that 21 years ago, and still being in healthcare today, and now leading a hospital and leading a service line, I know where I got my start from, and it was the School to Work program. So coming here, being blessed with the opportunity to partner with BI3 and with Mark Clement's support as our system CEO, giving us the green light to say, let's create that program here, and let's create a model for success that other health systems in this region and across the country can actually adopt, is just amazing.
Do you feel like it can, over the long term, help diversify our healthcare workforce?
I think the program was designed to really help students get experiences in healthcare, and indirectly, I think that one of the things that has come out of this program, and which is now a more direct focus is how do we diversify our healthcare and health systems? Because we know a part of building trust is culture and community, right? And if you have somebody who understands your culture, someone who's come from your community, and someone who can relate to you, and then oftentimes people who look like and reflect the community we serve, that trust is almost instantly built. And we know that through the School to Work program, we take students from the community, we put them in a community hospital, we give them exposure, we give them the skills, we give them the tools, and help build their knowledge to one day be healthcare professionals and come back into those hospitals and come back to the community and treat those patients. And these students are paid employees, they're working, so we're creating jobs. So when you talk about what's the economic impact of this work, we're creating jobs for a diverse population of students at a very early age. And then telling their parents to come apply for jobs as well, so they can partner with their student, their child, and work in our health system. So that the great thing about this model is the ripple effect, and this model can be created and duplicated and copied and stole shamelessly. Once we create our handbook and how to manual, because we want every health system in the country to embrace and adopt this great program.
That'd be awesome.
That's my wish. So
Mine too.
Great.
So what advice do you have to offer to other healthcare system leaders around addressing racial and health equity and inequities within the systems?
I would say I guess my strongest piece of advice is that you can't go in it alone. You cannot. There's no health system, no matter how big your balance sheet, no matter how much revenue and you bring in or profit margin you have, you can't go in at this alone, because this is a country-wide issue. And there's no health system that I have known or seen or worked with yet that has said they have achieved the success they need to alone. Go into the community and find out what's being done in the community. Ask your patients, ask your people, ask your team members. Team members offer great feedback because they oftentimes live in that community and there's things they want to see. And then look around the table and make sure that there's diversity around that table. Don't
Including
think
those with lived experience.
Exactly, those with lived experience. Make sure that you have a diverse and inclusive table of folks you're getting information from, taking feedback, and then start building on on that information and on those sessions to create action.
Well, I'm going to throw the gauntlet and challenge healthcare systems to think about identifying one or two health disparities. I mean, for us, it was infant mortality because, we have neighborhoods that have some of the highest infant mortality rates in the country. But identify one or two health disparities, and to your point, start having conversations, even with competing healthcare systems, right? No one's competing over health disparities. So how can they come together in new ways? Which I know is challenging to come together with competing healthcare systems, but how can you come together and really rally the community to start to improve a few health disparities together?
I think looking at it as a community issue and not as a market share competition issue. How can I gain more? What do I gain? I think looking at the data collectively and saying, of your patient population, what are you seeing? Do we have any common themes? If 5 health systems in an area got together and said, we are going to tackle diabetes in this community. We are going to tackle, asthma in this community. We're going to tackle hypertension. We're going to tackle, colonoscopies and colon cancer screening. If organizations got together and said, how do we tackle this together, and worked on some of those health disparities, we would see a lot of progress, and then we could put a lot of energy and effort toward those things.
Final question.
Okay.
So as you think about the progress we've made, and we still have a long way to go, but the progress of our collective efforts to continue to reduce infant mortality, especially for Black babies here in Cincinnati, and the culture change that we've been accelerating here in our own healthcare system, what are you most grateful for?
I would honestly say I am most grateful for the commitment, because I don't think we get anywhere without the commitment. And commitment means more than dollars. It means more than resources, supplies. It means more than people. It means more than time. It is giving up something. Oftentimes I look at commitment as, what are you giving to something? And it may be a combination of all those things. It may be money, it may be resources, it may be time, it may be energy, it may be effort. We're getting a lot of that great commitment now, and I'm beyond grateful for it. And I'm just happy that we are in a place where we have so many committed people that no matter what we see from an outcome standpoint, they want to continue to do the work. And even though we've seen a big win this past year with the results we've seen, the best results we've had in the decade, everybody's committed to doing more. So I'm very grateful for that.
And I'm grateful, when you talk about commitment, healthcare systems across the country have shown true commitment during this pandemic. And my hope is that they continue that commitment in new ways, especially to address health disparities.
Yes, I agree. And I think that if we can do that, if we can get together as health systems and partners in the community and do this as a country, then I think we will see a lot more in elimination of health disparities and really helping to improve the diversity amongst our workforce, improvement in equity, improvement in inclusion, and we will improve the health of our population because, as I said before, and I'll say it again, we are better together.
Better together. This moment matters.
Yes, it does.
Thanks, Jeremiah, for talking with me today.
The theme of this symposium is gratitude. And so again, I'm grateful to Quint Studer and team for putting this together. I want to thank our BI3 Fund partners, our Cincinnati community, and all of our healthcare heroes across this country who continue to show up and help those around them. You have shown us through this pandemic that you can do anything when you put your hearts and minds to work. And so I challenge you. I challenge you to think about how you can help reduce health disparities in your own community and hospital systems. I also challenge you to think about how you can take that one extra step to help us ensure more babies live to see their first birthdays. This moment matters. Let's make it count.